Hello and welcome everyone. We know more people are joining in and we know that this is only an hour and this is a very important, robust discussion. This is also being recorded, so there will be a link sent out to all participants who have registered, and it will add on to any of the other webinars that we've had from this series. Again, welcome to Racism That Appends the Cradle, how Black children are differentially vulnerable to the impacts of the syndemic, the economic crisis, disinvestment, COVID-19 pandemic, and climate change. I'm Nsayadu or Nsay Obot Witherspoon. I'm the executive director of the Children's Environmental Health Network, a national nonprofit that's been devoted for over 30 years to protecting the most vulnerable, including children where they spend the most time, the air they breathe, the water they drink, the food that they're eating. And we're honored to be with our co-host, Chisholm Legacy Project, a fantastic partner. If you don't know this organization, please look them up. Doing tremendous things at our community level, supporting leaders out here and trying to really inform a much more just set of systems moving forward for a variety of populations, including children. And I want to give a shout out to Jackie Patterson, the CEO, Executive Director of Chisholm. She isn't able to join us today, but definitely is here in spirit and has been a co-author of this report that then populates this webinar series. So a little bit about this, why Jackie and I wrote the Racism That Appends the Cradle report during the COVID-19 pandemic. We started during the shutdowns, and it was a very emotional process. We were definitely not naive to understand that this was going to be heavy. Really looking at and combing through a variety of literature and articles and data, specifically when it comes to the health, well-being, mental health, physical health, spiritual health of children, and specifically Black children in this country, in the United States. And what we did find, and probably no surprise, but on and on again, over and over again, the evidence shows that Black children experience the trauma of racism even before they're born. And they're confronted throughout their lives by a system that is designed not to support them. This report from the Chisholm Legacy Project and the Children's Environmental Health Network details, I would say, heartbreaking statistics that represent the lived realities of millions of Black children across the nation due to racist policies and practices. Those include, just as an example, redlining, the placement of hazardous waste facilities, systemic exclusion from shared resources. And our paper explores the ways that the historic and persistent inequities compound jeopardy for Black children and propose a framework for a just transition. We're trying to embrace systems that enable us to share all in abundance and thriving together and supporting all of children's futures, and not one that oppresses them or reduces their abilities to move forth on their projected futures. So the purpose of this webinar series is to take portions of this very important report and really start to create more of a bite-sized level of discussions, even though all of them are very big and heavy. And we're trying to bring in thought partners and leaders like we're doing today around the need to call out the layers of injustice focused on children, especially our highest risk children, and identify viable, effective solutions. That's really important to us, to not just have this place of deep reckoning of what we have and continue to do as far as generational impacts to children, but more importantly, to lift up efforts that we believe are getting it right. Examples of those resources, those tools, those community programs that could use more leverage, more money, capacity, attention. So today's focus is on racial healing and justice and the importance of these issues to children's health and well-being, especially Black children. So truth, racial healing, and transformation. This is a comprehensive multi-year national and community-based process that's been unveiled and that has been the reality of communities for many, many decades, bringing together transformational and sustainable change. It's kind of the original foundation of our discussion today. Now, racial healing is at the heart of racial equity. Racial healing is about the people who work and lead towards transformation of systems like here today. It's the telling of hard truths shared about past wrongs and present consequences, and in many cases, current wrongs. It's repairing the harm of racism, which does not happen overnight, it didn't start overnight, but it is the process of going on that healing journey, replacing the deeply held system that fuels racism with one that sees the inherent value of all people. And in this case of this discussion, the most vulnerable of our people. And it authenticates relationship building across real and perceived differences. So what we're going to do is introduce our fantastic leaders joining us here today. I'm going to briefly introduce them, and I encourage each of you to also explore and share anything else with our participants that you're feeling right now. We're going to have about 5 minutes from each of them for introduction, remarks, and then we're going to go into a panel, very informal discussion. We have some questions, but all of you are definitely encouraged to use the Q&A question answer prompt at the bottom of your screen. Just keep posting your questions and we'll do our best to field them. There's also going to be a variety of resources and tools and websites that will be posted periodically throughout the webinar. And if there are any additional questions that we're not able to get to, we'll definitely make sure that we add as much of those responses in our follow-up to you all after the webinar. So Robin Bussey is the Just Health Director with Partnership for Southern Equity. We're so happy to have you, Robin, joining us, and please for your opening remarks.
Thank you. I'm glad to be here. Thank you, Insay, and to my fellow panelists. So I work for the Partnership for Southern Equity. We are an Atlanta-based nonprofit, and we focus on advancing policies and institutional action for shared prosperity for all. I have to put an emphasis on all in Metro Atlanta, Georgia, and the American South. And our beloved founder, CEO Nathaniel Smith says we are going to the global South. So we are going to be all over. And we do this through an ecosystem model, of which health is just a part. We have other components of our ecosystem, just energy, just opportunity, just growth. I'm probably missing one. And Yes for Equity, which is our youth power building arm. So we all work in concert to advance health equity all over the state and, of course, all over the South. And I would encourage you to please go to our website because there's so much more I can say, but I want to leave time for my fellow panelists. So glad to be with you all today.
Thank you so much, Robin. We also are honored to have LaQuanda Renaud, Austin organizer for Communities United, with us. LaQuanda, please.
Yes, thank you. Glad to be here and glad to be a part of this conversation as well, as we kind of continue to build out this vision. And so I'm LaQuanda, I'm in Chicago. I was born and raised on the West Side, and what I bring into this work is my lived experiences from growing up on the West Side, but also, seeking out as an adult and like navigating my own spaces as a Black woman and figuring out some ain't right. And so as that kind of happened, right, my passion laid in what we do here in Communities United, starting off as a college intern, and building up into this healing space that for myself that we've seen as we make changes in our community, it also brought back this healing and this understanding of who we are in our own identity, and then the changes that we seek brings communal healing to us as well into our community. So it's a little bit about myself and what I do. I work with young people on the West Side.
Thank you so much. And we have Shawnee Saxon, who is the founder and executive director of Kids Turning Corners and director of Healing for One Love Global. Please.
Absolutely. Thank you all, and thank you all for joining. My name is Shawnee Saxon, and I am the founder and executive director of Kids Turning Corners. It's a nonprofit that I founded about 13 years ago to really help young people, mostly young people of color, to develop resources, find resources, and receive the kind of mental and behavioral health care that they would not normally receive. Most of the clients that come to Kids Turning Corners are Medicaid or some type of state medical program recipients, and they may not always have the financial ability to pay deductibles, co-pays, things like that. So Kids Turning Corners make sure that we kind of fill in that gap to support them, and so that they have access to quality mental health care and to clinicians and therapists that look like them, can relate to them, have the kind of cultural sensitivity that can work through the kinds of issues that the children that we see tend to have. and also in the capacity of healing director for One Love Global. Same kind of concept is we are working to help Black youth empower themselves to become whatever version of themselves that they see and want to be, without feeling like they're criminals or feeling as if they do not have a place in the society, and to lift that feeling of oppression from the community. And so we do a lot of work to make sure that we are dismantling that with the youth in our community.
Thank you so much. I'm just excited to be here in this space with all of you and to learn as well. I encourage us also to talk, storytelling is huge in our cultures and our history, and not always expecting, right? Not that we are, but at times out here that everyone's going to go to a peer-reviewed literature or some other resource and somehow find about these fantastic programs. So by any and all means, lift up your stories, lift up some case examples. Just one quickly that comes to mind before we get into our panel. I'm here in the Washington, D.C. area. Our headquarters is on Capitol Hill. Capitol Hill, if any of you have been, it's beautiful, pristine, unfortunately now security at every corner. That's the day in life we're living in, but not even a mile away in various directions. It's a totally different story. This is our nation's capital, for example. So there is a community called Ivy City. Majority of it is concrete. There's hardly any green whatsoever. But at the same time, you have had homes that have gone through generations of families. So majority of these families own their homes outright. Or this has a very strong connection to community. But we've done tours. We've been with groups like Empower DC and other wonderful community advocate groups where community members have made it very clear what their vision is for that couple blocks of space. And yet there's been this tug and pull. There's been successes here and there. But one thing that stood out to me when I walked through the streets and talked to our community members here and just listened to them, the one place where kids can go and play and it's open to them is the Juvenile Delinquent Center right there in the community. So they encourage the kids to come in and play basketball. So what is that already telling folks? There is a community park that's full of needles and many other things that's not cleaned up, that no one would want their child or adult to be spending time in. And yet, instead of cleaning up the green space and re-envisioning that with the community, you're telling kids to go play basketball at a juvenile detention center. So if that's already not setting the tone for how, in this case, mostly Black young people living in this community in the District of Columbia, about a mile from our nation's the capital of our nation is, I don't know what else I can say about that one. But the bottom line there is, though, there have been, after many, many years, some success. There's more resources coming in. There's a community center that's going to be used to revitalize an old school. But these are things the community saw 10, 15 years ago. They've allowed the beer gardens to come in and some of these other businesses to come in, no problem, and kind of regentrify part of the community. But as far as the basics of just having a community center, having a place for people to go safely and to exercise and to be kids, no. All right, so on that note, and on that note of, revitalization and healing and calling out injustice, each and every one of you works to dismantle racist systems and to address children's health and health equity through different approaches. So Robin, starting with you, through building and strengthening cross-disciplinary partnerships around community organizing, leadership development, and coalition building to address health and health care disparities, could you talk a little bit more about some of the successes and activities and even challenges that you're running into?
Sure. And when you were telling your story, I was thinking of about immediately 3 neighborhoods in Atlanta where that could apply. So at the Partnership for Southern Equity, we really focus on what we call values-based organizing. So what we do is really build relationships with people. We consider ourselves relationship accelerators as well. So it's not that we are going to communities, we go where we're invited. And we're not going to communities because we have the prescription and we want to impose our will. We're going to build relationships. So it's not just let's focus on this particular policy we want to advocate for. What do we have in common? What can we do together so that as we continue this fight, because it's a multi-issue fight, everybody lives their lives at different intersections. So how can, we count on you when there's a policy before the legislature that we want to have the community organized around? And also, how can you count on us when you need our strengths and our expertise to come out and support you? So it's really about building genuine and authentic relationships. To your point, there's so many areas that have been gentrified in Atlanta or continuing to be gentrified in Atlanta, where our legacy residents are being, left behind. But every time there's a needs assessment, they're going there and they're surveying them and they're giving them Chick-fil-A gift cards and all of that, and then they leave. And so they're tired of getting over surveyed, data extraction, all this extraction, and no one's really building relationship with them. So we want to make sure we're very intentional about building relationship and recognizing everyone's strength. We don't stray from the word empower. Everyone has power. So how can we lift up the power that's in community and really just be a support and lead from behind, and not kind of go in with, this is what we think you should do. Rather, just making sure we listen and try to be a part of the solution, because we do believe folks that are closest to the problem actually have the solutions, and we need to listen and amplify that. So
Thank you, Robin. I mean, you're just amplifying core public health outreach engagement strategies, or just human connection, which quite frankly, I'd say our political system and a lot of different systems could use a lot more of. Just, we don't have to see eye to eye on everything. That's fine. That's part of the human experiment. What I believe we do need to do more of is actually hear each other out, because there have been numerous examples of the most conservative, for example, person to the most liberal person. They didn't see eye to eye on most things, but what they could come together on is the health and well-being of the children in their community. Whether you're a child or have children yourself. I mean, there are many other unifying factors, but that's one we lean on every day. No one usually wants to go on record and in public saying, I don't want to protect kids, but yet our actions do not also follow up with those words. So thank you so much for reminding us some core values of human connectedness, being intentional about these partnerships, right? I'm sure every single one of you are inundated with requests to partner, and yet our capacity only goes so far. You're doing extremely busy work every single day, helpful, fruitful work, and you have to prioritize all the time, right? Who do you engage with? Who do you spend another hour with? So thank you. And yet I know each and every hour that you all put, minute that you all put, and many who are here, all who are here, actually, there's many wonderful advocates and leaders joining us today, does mean the difference in the life of a child, whether we see that actively or not. Laquanda, through implementing the Healing Through Justice model, engaging and training young people of color to conduct youth-led research, which I love, building alliances and leading strategies and advocacy campaigns that are grounded in their lived experiences to change their communities, right? Their energy. What would you say have been some of the strengths and your approaches that you're seeing as far as the change that it is making, or the opportunities, the on-ramps that it's creating for the young people that you're serving?
Yeah, thank you for that question. For us, right, it's really about identity, right? And so a lot of times, right, as people of color, Black and brown, right, and understanding where we come from, and then how our lived experiences has impacted us. And so that's really deeply embedded in all the work that we do is around that identity piece, because a lot of times it's broken down to say you're bad, you're this, it's stereotypical. And so a lot of the work that we're doing with the young people is being able to kind of get them a space to reflect. What have your lived experiences been? Who do you want to be, like, how do you want to be identified, right? And being proud of that, right? And so that's been a part of like the biggest things that I think that makes our work very, very, what is the word I want to say? Like impactful, right? To like come out being as a young person that kind of just be like, I'm a Black young man, I'm a Black young woman, I'm trans, right? We have, a lot of different identities that we bring together in this work, and being able to just really identify and say and claim who you are is very powerful, because as we go up against a lot of these systems that we're talking about that, have been oppressive or put in power and play, right? We push back. This is what I go through, and this doesn't make me less than, right? And kind of like being able to challenge the narratives that's been pushed upon. So that's like, for me, is one of the big pieces, and how we kind of see like how the healing process is also kind of, how that happens, right? Being able to acknowledge who you are, and being very asset based is one of the things that we talk about, right? Similar to how Robin spoke about the value based and how you come into your community organizing. Definitely like with the values and assets, right? You're not bad for just being, for me, I'll be honest, right? I was a young mom. Someone call it a teen mom. I like to just say young, but but in doing that, right, I've been able to kind of just share like, well, that's my experience, right? And that's what makes me amazing, actually. And being able to claim what my experiences have been. So I appreciate being able to do that and doing that with more young people. So it becomes a healing process as well.
Thank you so much. Re-emphasizing, claiming your presence, your existence. You are fantastic and you were meant to be here, and your story, your lived experience means something, that value add, and you're absolutely right. This is not the first time in our history when these attacks on human existence and people's notion, core being of who they are is then somehow attacked because other peoples don't understand it or what have you. Whether it is how I describe myself in my pronouns, or the community zip code I'm living in, or the gross assumptions people made just obviously by looking at any one of us, which at times can even translate into how the type of medical care you receive. I have some examples of that too, where people made gross assumptions about one's well-being and their nutrition and food, and that resulted in the type of medicine that they were prescribed, which they had adverse effects on. If they had just talked to their patient, not make gross assumptions about what I eat and what I don't eat. Not everyone eats fried chicken every day, like these gross assumptions about what the makeup of who we all are as African-Americans walking around in this space called the United States. So anyway, thank you for that. Shani, through your work in private counseling and consulting practices and your nonprofit to address mental and physical well-being, as you mentioned earlier, for young people of color, a vital set of work, especially those who are uninsured or underinsured, and also through providing support for future young leaders and students transitioning to college and adulthood. There's a lot there as well, right? As you mentioned, a lot to cover, a lot of layers of injustice that have even gotten us to this place where these are still such urgent matters to address in a substantial way for our young people, which of course has viability for their adulthood. Please, your perspective on how, racial healing obviously embodies all of that, and how some of that is taking place in the work that you do every day.
Absolutely. Thank you so much. One of the things that I'm hearing across the board is the impact that mental and emotional health is having. And as you were even talking about, this location where they're having youth, to go play basketball, huge environmental justice issue. Absolutely. There's a narrative that you are sending directly to these young people about their value. And that is one of the things that is most problematic, because we know that our young Black kids and kids of color are getting, these labels. They're being labeled immediately, those gross assumptions, that's making them feel as if they don't have the ability or a voice. And, at our agencies, we talk about that. Our students have definitely been very intentional about having conversations and voicing their opinions about what they want. So it's not even so much that they were asking for a seat at the table. They literally said, hey, we built our own table. We're pushing it up next to you all because we want to be able to tell you what our needs are and what we want to see in our communities. And so we make sure that we stay as open as we absolutely can to talk with them, to see what they want. I would imagine that if they ask the youth in your community, like, how do you feel about coming here and playing basketball in this space? I'm sure that they would probably get some feedback around how, sometimes it makes them feel uncomfortable or undervalued. And we want to make sure that our youth feel valued, right? And so in our agencies, we use the theory of change in a lot of ways, and it's kind of our version of change, because what we're trying to do is break these kind of like transgenerational and intergenerational cycles of poverty and trauma. One of the most important things that we can do as we are navigating through each generations and generations of healing, like to be, let's be honest and transparent. We've been going through, racial trauma and race-related stress for centuries, and the epigenetics of it, how it's sitting on us, how we're coping with it day to day, being people of color. it's more than a notion. I have tools, I have people, I have resources that a lot of my peers and colleagues and other people don't have, and I still struggle with it. So when we're really talking about what healing looks like, we got to be really intentional about what healing looks like. Yes, going to therapy is important for sure, but addressing these issues and addressing them at the core of what's happening is probably the most important, because we know that DNA is in us. So we have to make sure that we are creating strategies and pathways to change so that young people can actually say, I know I'm being heard, and I also know that I'm being really seen. And I think that that's really important. Healing, youth healing circles across the board. As you'll hear down the line, I really appreciate and value the impact that healing circles are having for youth in our communities. And I want to continue to make sure that we spread this message across the board, and using a platform like this absolutely gets the job done.
Yes, thank you. Thank you so much. And I love the way you're already getting into some of these resources, the tools. Again, it doesn't have to be a one size fits all here at all. What is nice though, is that there is an abundance, I'd say, of thought, thinkers and elevated folks who are trying to not just call out. We got to first start there. We got to call out these layers of injustice, call them what they are, so that we can have some type of strategy. And the strategy that might work for this group of young people may not work over here, and they might just be a mile apart. But what's nice is there's a whole list and options. And that's why webinars like this I find very helpful, because the sharing of resources, the sharing of your organizations and your missions, the tools, the techniques that you're using, these are all ways to do what Robin also talked about earlier, making these connections so that we can all be stronger in our ways of providing service. So I also just want to talk about, resilience for a minute. And I want to talk about you all as leaders in this work, any in this particular women of color who are passionate, clearly, who are embodied in the work that you're doing. It's very hard to not potentially become swallowed up by it, right? This is real. There's burnout in nonprofit work, community level work, which is unfortunate, but very real. So there's two parts to this question. What does racial healing mean to you and you as a person, and how you come to your work? And then, of course, anything else you might want to say with how you approach that, and then how the output, what you give to your work and your team and your community, how do you believe and see it making a difference? And what might be some challenges? Because we're not all perfect. I should say, you also can be connected to all the resources and tools in the world. And if we're not utilizing them or leaning in on them or being consistent about them, it's kind of like going on that latest diet, right? You're only as good as, as long as it lasts. And I won't go there. I'll leave that alone. But so yeah, please, resilience has its pros and cons, right? And our communities have been labeled resilient for so long. But what has this meant for you and your personal journey of racial healing first? Because our kids are watching all of us.
I'll just start. I have lately been having, and I would say my approach to this work, we do a lot of training and technical assistance. And so one thing we like to focus on is language. Language is huge. Like, let's make sure we're saying the same things, we mean the same things, so that we can communicate. And we also make sure that we call out history. History is happening now. So, it's not something that happened to our parents, it's happening today. So just making sure all those things are important. But I've been having this uncomfortable, I think, relationship with the word resilient, because it's as Black women, as Black folks in this country, I'm tired of being resilient, personally. Like, I want the systems to be dismantled so I don't have to be resilient. So like my son doesn't have to be resilient. Like, he shouldn't even have to experience the impact and the trauma that unfortunately he will at some point, because he is a Black child in America. So I'm really just kind of, like I said, it's an uncomfortable relationship, because, being Black in America, being a Black woman in America is difficult. And so every day we have to find ways to be resilient. And, that's just something else we have to do, I guess. And so I'm just really, that's just me personally having this struggle with that word. But, it's an ongoing process. You can't, like you said, it's not one size fits all. It's not even what you did last week is going to work for today. So it's really a lot of stepping away sometimes. And that's so hard for us, because the work continues. never ends, unfortunately, but sometimes you really have to step away and breathe and focus on the good things that you have in your life. And sometimes that means, if you got to go binge Netflix, that's what you got to do. If you go to therapy, do that. But it really is what is going to work best for you so that you can keep going in this work. And I think even when you step away, you still find that inspiration to keep going. Yeah, and for our communities, it's just about, the work that we're doing, just making sure there are opportunities, like to hear people, to understand what it is they need, and then to try to work with them to craft the solutions. Again, not us crafting the solutions. And then also just getting that understanding of collectively as a community, this work is hard, but also if we don't find joy, if we don't step away, if we don't, do whatever we have to do, we're going to kill ourselves. And that's not going to help anybody. That's actually exactly what, the other side wants. And so we just really have to be really intentional about taking away that guilt of, what if I take a break from this? What if I don't go to this protest? What if I don't read this particular blog? Like sometimes you have to do that to be able to be refreshed and to keep going in the work. So I don't even know if I answered your question. I think I started just going a different way when I heard resilient. So yeah, those are just some of my little thoughts.
No, very, very welcome. Thank you. And I think we all resonate a lot with what you just mentioned. It has to start with us first, right? And you're right. The pressures on our collective shoulders as women first, and now women of color on top of it, it just never ends. It's kind of like the work itself. So when you've got that pressure in society, then you got the work realities that, you're right, never end. The to-do list just grows. It doesn't. It's so true. I mean, this notion of healing and what we all go through day in, day out is real, and how it embodies and how it kind of, stays here, or hopefully we find healthy ways to release. It's very real. And then throwing on top of that, all the ways that we are relied on in our family units and our communities, and that it's very real, right? So thank you for calling that out. And I am very excited that Chisholm Legacy Project and many other groups are recognizing those realities and are trying their best to support especially women leaders of color out here, because again, we're no good to anyone if we are not here and here as healthy and vibrant as we possibly can be. So I really appreciate all of that. Any other thoughts along those lines?
Yeah, I will piggyback off of Robin, like, because for me, the word is strong. Like when they say you're a strong Black woman, oh my God, they'll be like, hold on. I get a lot of stuff done, but and I think what I'm hearing is, and I think what we're doing too as leaders is really challenging the things that comes up that in our present day that can be problematic, right? And so like, having that relationship with the word resilience and strong, and understanding that it's not just my responsibility, especially working with young people. And this is why I get a chance to stay into this work, because a real reality is that these young people are not my kids, right? And so they are somebody else's child, and they do have teachers, they do have other spaces that they're in, that young people are there, right? And so being able to make sure that I'm pushing and challenging those people, that what's your responsibility? Because it's not just mine, right? I do have a responsibility, and I with my young people, and I love my young people, right? But the reality is that it does take a village. And so being honest about that I don't have to be the strong Black woman, I don't have to be resilient every time, to make sure that we actually do something that's sustainable. I think that was one thing that kind of came up for me as Robin was talking. And then how else, just kind of being in the healing journey myself and being honest about that to people, that I don't got it all figured out. Healing is not something that just is 1, 2, 3, you know what I mean? Like I wake up and I'm like, yeah, I'm healed because I'm doing community work. No, because, to the point that we understand that this stuff is years and years and decades of trauma, right? That we're unpacking and it's work. And so just being real about that and being honest that healing is a process, and it's something that can go up or back, right? And all of it is still healing, right? If I cry today, I'm still going towards my goal of, acknowledging and understanding, right? But if I'm really happy and vibrant and able to participate in everything, it's still a part of my journey of healing. So just using some of those things is some of the things that I can see doing by practicing that helps in this process.
Thank you.
Happy to
We-
jump
we-
in on this because when Robin said that she was resistant to the word resilience, I'm like, yes, because I am not a fan of that word either. Haven't been for a long time, just by virtue of being a therapist, and recognizing that that was kind of like my trauma response to my childhood and the things that I experienced growing up, and recognizing that I had the power and the ability to empower myself, right? Empower myself to change my dynamics. I recognize that everyone doesn't have that luxury. And so being resilient for me is really just saying, hey, you just keep taking these hits. You keep taking these hits and you keep getting back up. And I'm like, I don't want to do this. I want to have a soft life too. I want to be able to wake up and enjoy my family and enjoy myself and not have to feel like I always have to I have to put on an armor to fight, these kind of like social structures that are just intentional on taking me down, right? It doesn't feel good. So I do not like the word resilient. I prefer persistence, to be honest with you, because if I'm nothing more else, I'm definitely a persistent person. But with that, I also think that one of the things that we struggle with and continue to struggle with is, especially as Black women, I'm finishing up my PhD, and I am recognizing that, when we're talking about Black women and we're talking about how heart disease is the #1 killer of Black women, I start thinking about the weathering that we're experiencing, and, even being complimented on, our age and Black don't crack and things like that. I do not lean into that because I'm like, our Black might not crack on the outside, but we're cracking on the inside, right? So when we're talking about allostatic load and what's happening on the inside of our bodies, the places that we can't see, we've got to be mindful that our self-care is just as important. I think that, and I love my work. It's my passion. I am so purposed to do this, and I am so thankful that I was able to figure this out at a really young age. But I also recognize, especially in the moment when George Floyd was murdered, that moment was a pivotal moment in my career, because I think that was the moment that I absolutely remember developing compassion fatigue and struggling to do the work with my clients. So we're really early on in this pandemic, and George Floyd gets murdered, and I'm watching this and I'm thinking, even in the middle of a pandemic where people are dying every second of every day, racism is alive and well. And it broke my heart, to the point where I literally had to take time off of work just to gather myself. So those are the challenges as people, as women who are healers, that we continue to face. And we still wake up every single day to kind of deal with this work. And some of the other challenges that I find, especially when working with young people and youth of color, is the buy-in, right? I find that they have a hard time sometimes buying into the notion that we really are here to help you. Because again, how many programs are out there? How many agencies are out there? How many people are out there saying, hey, come on to this, and we're here to help you and support you, and then funding gets pulled because, again, grassroots agencies sometimes do not get the funding that bigger agencies get. So then they disappear, and it's hard to get youth to be able to come back and trust. And then also stigma, the stigma around mental health and mental wellness. It is sometimes hard to talk to youth when their family members, elders are telling them, you're not crazy and things like that. Things that I run into all the time that I have to continue to kind of like flip tables and educate and do psycho education to get people to understand that it's not about that. It is really about emotional wellness. And then having access, things that we talk about all the time. How do we get young people to even show up? Like, we can go to them, but we can also find ways to get them to us. But again, these are issues around budget. These are issues around transportation, where you live, location, having access, things like that. And are you even safe coming to our agency in order to get the help that you need? So I just find that there are just challenges across the board, but I try to be as transparent as I can. If I'm having a bad day, I may let my client know, hey, this is a rough day for me, especially with George Floyd. I remember just having those conversations, like, we might just need to sit and hold space for each other for right now, and that is okay. So just being like really transparent and being open and honest, I think really opens the door to having healthy conversations and healing conversations.
Thank you so much. There's so many things that you're all just stirring up for me, which is important, right? So again, it doesn't all land here. The reality of women of color dying from breast cancer, even though we are better detecting it, for example, from heart issues and on. Stress kills, right? In general, there's a lot of stress, even though folks, really good point, Shawnee, on the outside, I might look like I have it all together, but guess what? I've got a lot of things, and this goes generational. This goes backwards. I'm also thinking about so much of what you all have said before we also get into some other frameworks about positive examples here. But as far as reaching youth where they are, there's a lot of efforts that we're a part of too, to try to connect our children with nature and all the restorative energies that we all gain from just being outside. And yet we're hearing all the time about our air pollution, wildfires are on the rise, and then we have to dictate at what point of the day, if you're in an urban thoroughfare like a Washington, D.C., and it's 110 degrees with a heat index, when do you take the kids outside? Do you keep them inside? What's less pollution? Kids need to be outside running around. They, for their providers, they need to be exerting that energy. But I mean, when you think about the realities of, it's not just about the funding, like you mentioned, Shawnee, it's not about getting permission from the families. What about the criminal aspects? A lot of families are not okay, understandably, with their kid going to an after-school program that may take them to parks and wonderful things, or summer camps galore are happening right now. But if I'm working and I'm working off site, a lot of these camps end at 12 or they end at 4. I mean, it's not viable, or they're starting at 9. My work starts at 8 or 7, or I have to commute. So how are my kids even getting to this wonderful, even if it's paid for, or I'm paying for it with my property tax, so there are many layers of this, and it gets down to the who has access. Who has the money? Who has the ability to get transportation? Who has the ability to be in a safe space? Or who has the ability to lean on others to create that synergy? So I get it. Mother of 4, I get it. And I still have access that many others don't, and I still get frustrated. So thank you all, as always, in all these discussions, for bringing forth and being so vulnerable and bringing your personal self to this. I'd like to transfer us a little bit to hopefully positive models that you're seeing out here, either you're a part of or you've heard about, that you just maybe want to lift up. Models, techniques, strategies, programs. As we all know, they're never done, right? But even if they're in their beginning stages, the innovative, creative thought thinking, I think whatever you want to say and lift up, the time is now. And if there's any that you're seeing that are impacting, obviously, all of community, but as I say often, if we think about the framing of children and what children and our youth can sustain, it will create a natural buffer of protection for all of us, as in theory, of not being as vulnerable as them, as far as their mental health development, physical health, respiratory health, all of that. So any examples, any case examples you want to lift up where racial healing techniques, strategies have been embodied? Maybe it hasn't been obvious, but you see it as such, because we all have talked about this is all connected, and where it is or has started impacting in a positive way the lives of young children and young Black children in particular.
I can go ahead and share. I don't have, I'm gonna be selfish and just use the time to share more about my work, because I feel really passionate, and I be embedded in it, that I could speak to it in that type of depth. But for me, I feel like the work it is around like the identity building and the understanding what are some of these challenges, right? What are these lived experiences that we're going through? And so we do work in, I mentioned like working with young people where they're at, and working in the spaces where they will be at. So that means that we do connect with the schools, we connect in with their parents, we're connecting in all of these different spaces that young people are going to be at. And so we call our approach to our engagement of organizing is healing through justice, right? And so what that means is that as we are going through the education and the understanding and building on our identity and connections with each other, because it's a lot about that relationship building within and creating a new community. I talk about that a lot in the classroom, right? Because we got cultural norms, right? And so we do have different things that we do that can be harmful, sometimes, right? The way how we approach each other, but it's normal as well, right? Because this is what we're doing. And so just doing these different techniques and exercises with young people that allows us to get to know each other and set that space that they understand in their peers as well, right? And then also building that out to really think about what systems are impacting our lived experiences. And so we're doing that working within the schools. Chicago is a really big city, but it's also very segregated. So, what the West Side and North Side and South Side look like is very different from each other, but it's predominantly, you have spaces, like I mentioned, was very segregated. And so you have spaces that is predominantly black and brown, and where you see most of the divestment and lack of in those spaces. And so being able to also give the tools to young people to understand how do we do our own research, how do we do our own inquiry of our communities, so we can share you what it is that we need, right? And so building up that empowerment within our young people and for our community. So like Shani mentioned, right? Like we're gonna create the table, right? And pull it up next to you, right? So you can understand what it is that we need. So those are some of the things that we're doing at Communities United. And for me, I would say, like, in doing that, it's like I said, I mentioned, like, it's also it's a reciprocal, like, healing for me, right? Because I did grow up on the West Side and been through a lot of these experiences that our young people are experiencing. And so being able to create this communal healing in that way.
Thank you so much.
I am happy to also, take some of this time to kind of uplift some of the work that we're doing, because what I find to be one of the most impactful ways of helping young people explore themselves, just not even just from a clinical space, but from a communal space, is doing, healing circles. And so we've been doing like youth healing circles for several years now at One Love Global and Kids Turning Corners. We collaborate and we try to make sure that we invite youth to come and do, these healing circles that have come from generations of Indigenous and African culture, right? It's just a way for people to get together and discuss issues that are impacting their overall well-being in a group, but also, that will allow them to like pull out some information about themselves, learn a little bit about themselves and the people that they are in relationship with, and also have some relatability, right? So, we just last night, One Love Global, hosted Lansing People's Assembly. And so we invite members from the community to come in and discuss issues that are kind of relevant to us and our overall well-being. And so, we had this meeting and we were just kind of talking about the Michigan Breathe Act. And, like right now, it's currently like about 151-page document, and it's a running document that we're developing as a roadmap to kind of introduce provisions for divesting from like policing people of color and Black youth, and creating these kind of unrealistic consequences that young people are experiencing right now should they find themselves in the legal system or having like a mental health crisis. And so we're kind of working to reimagine and reclaim and repair harm and rebuild from centuries of racism and hate. And so the idea is to introduce this into legislation so that we as healers, as providers, as people who work in this field can really have the ability to design and the outcomes for youth that are going to be much more better and much more healing for our youth of color. And then obviously those healing circles with youth are extremely helpful. When we did a healing circle, when we first started having the ability to kind of come in person again, once the pandemic, after all of the shots, the boosters and all of that, did an amazing youth healing circle with our students. And, one of the things that kind of came out of that was a lot of the students were feeling like they had nothing to look forward to, right? And it came out. And so we really had a deep conversation about that, like, what do we call that? Is that suicidal ideation? Is it passive suicidal ideation? Or is it the reality that students are being stuck in their bedrooms for hours on end, looking at a computer screen, and they're being inundated with information, but they're not able to connect. And so we really are trying to work hard and closely with students to listen to them and what they need. And they keep telling us that what they need is engagement, and they need to be heard, and they need to be able to feel like they have something to look forward to in the future. And so our healing circles, our Breathe Act, and our PPM group that we have is called Peace Prosperity Movement, but that's what a whole other conversation. I feel like we really are introducing a lot into our community that is extremely helpful to our youth of color.
Oh, this is so important. Thank you. I mean, there are a variety of strategies and legal strategies and policy strategies, while they take longer, are not to be forgotten, right? So thank you so much for bringing that into the conversation. In our last couple minutes, I want to prime our speakers. We're going to ask one last question here, and then if all of you could go around and just share your one last points of innovation and thoughts here for our participants before we wrap up, I'd so appreciate it. Thank you so much to Emily, because we did want to transfer into ways that participants and anyone else that listens to this after the recording is available can assist in these movements of racial healing. And many of you have been bringing up strategies, approaches, and resources. And Emily says that this is a very impactful discussion to her. She thanks all of you so much. And she identifies as a white LGBTQ woman, educator, caring community member, STEM professional, who is an ally and a champion for continuous improvement and being anti-racist. What guidance would you provide that can help she and others in her position to support youth and those leaders who are helping youth like all of you in racial healing and offering both a holding space for youth, actively listening, while also encouraging in community work as well? So bottom line, what are ways allies can engage in healthy ways that our Black, Brown youth can engage with in a healthy way to help support their health and well-being?
I would say use your privilege. Use those spaces where you are, where Black and Brown youth and other marginalized folks and youth are not welcome, where you are, kind of share the power, step to the side, amplify the voices of those folks that need to be heard, the folks that have the solution. And, like I said, if, you have connections to funding or resources or, platforms that are not always available, absolutely share those, but share those in a way that does not center you and your experience, but centers the folks that we're really trying to work with and support. As we were talking about youth, and I didn't get a chance to say much about our Yes for Equity portfolio, but that's our youth power building arm, and they do amazing work. They actually are employed as in our spaces and work with us as colleagues and not youth. And one thing they tell us all the time is we ask them, like, how can we help? So a similar question, but how can we as adults help? And frankly, they tell us to get out of the way. It's not always easy to hear, but get out of the way. So I would say that's what I would also say, probably in a gentler way, but use your privilege and then, step aside, get out of the way, and let the other folks, have their space and their time.
Thank you, Robin. Anyone else?
Yes, yes. I was going to, like, just for the sake of time, but it's like making me think of like structural violence and how racism manifests itself within like underserved communities primarily, and creates this systemic disadvantage. And so very much like Robin is saying, like I think that our white allies and accomplices need to use their voice and their resources to kind of like center the voices of people who are underserved and people who have historically been, dealing with, systemic racism, and, just kind of engage in what that looks like, but also being comfortable with having discussions around specific issues and problems that are relevant to Black youth and Black people and what they're experiencing, and commit to having these kind of like open, direct, and non-threatening communication and discussions, and avoiding any type of white savior trope, at all costs. So that's my thought around that. So thank you.
Thank you.
I would just underscore what both Robin and Shani shared, and then it's about the spirit that you come into your spaces with your young people and with your students with, right? And so practicing that honesty, like the honesty and the acknowledgement of the racism that exists, but also who you are as well, right? But not in a way that we're able to share and understand each other, right? And so just really the spirit that you bring into the classroom and being in these spaces with young people is what I would add.
Thank you so much. It takes a village of all sorts, and for folks that truly understand and are real about what we have seen, their generational impacts. Obviously, we welcome any and all, as the civil rights movement did, folks to be at the table. And as has been said eloquently, please step aside also. If connections can be made, the leverage can be made, potentially folks may hear others more than us, whatever it takes, right? For especially our young people, I think that's where we're all at, because this is an all hands on deck. That's again, why we wrote this report. It's not just about one pandemic, it's about multiple pandemics happening upon our children who had nothing to do with our political structures, our climate change issues, our injustice issues. They weren't even here, they weren't even born, and yet they are feeling the brunt every day of the impacts, even in their womb as their first environment. If I could take just a minute or two to just circle around, any last parting thoughts, any additional resources, we can always add some to our communications later, but please, as we go around, maybe LaQuanda, any final words here?
I think I would land it on that spirit piece, right? And like, being able to come into this space and to work to understand and to know it is going to be a struggle, but we do got to take care of ourselves while we're doing it. And so just making sure that we be realistic and honest. And so checking in on your spirit too, right? Making sure that that's filled. So I think that that's a really good disclaimer as we enter these spaces for ourselves.
Thank you so much. Being true to ourselves, vital.
I think in terms of resources, obviously I really value Dr. Gail Christopher, her book, RX Racial Healing. I think that is a really good resource for people to engage in as necessary. As a clinician, mental health and mental wellness is a necessity. And unfortunately, there's this huge stigma around it. And historically, Black people and people of color have been ignored. And so, as professionals and humans and things like that, we need to be focused on it. And so my hope really is that, we continue to pour into youth and youth of color. We continue to build their confidence, and we continue to work to heal them and ourselves and our society at this point. So thank you so much for that final word.
Thank you so much. I've had the honor of being an RX Racial Healing Facilitator trained by Dr. Gail Christopher, who's also a friend. And we need more facilitators. We need folks that can help convene these healing circles that allows no hidden agenda other than just human connection. And just, again, the power of listening and the power of stories, hearing people's stories, which most of us align with more than we think, even for someone who we might think we have the least in common. And Robin.
Yeah, definitely underscoring what LaQuanda and Shani said. Take care of yourselves in this work. In just life, give yourself a break and grace. I think grace is really huge. Just take care of yourself. And at the same time, in this work and working in this, in this space as an ally or whatever, you got to get comfortable with being uncomfortable. So if you want to approach this work thinking it's going to be easy, we're going to get the kumbaya in 6 months, this is not for you. So just be okay with, feeling uneasy and not feeling okay. And sometimes you got to go back. Sometimes you got to, you take 3 steps forward. So you just kind of get comfortable with that. But at the same time, take care of yourselves, because, if we don't, we won't be here to do it. So we won't be here for our kids to help them do it. So hopefully they don't have to do it. Really, that's where we're trying to get to. So yeah, take care of yourself.
Thank you, Robin. I just want to acknowledge all the amazing accolades you all have been receiving. I don't know if you're seeing the chat, a lot of affirmative connection and feeling heard from our participants. There is a final question here about if there's a list of Black mental health providers. So I'm sure we can identify resources like that for folks afterwards in our communication. And just real quick, I'm going to do what I do, which is a quick kind of summary of thoughts. We've heard about intentionality of partnerships and the power of connection, calling out history in order to move forward, being tired of being resilient, time to step away and breathe and focus in order to be an advocate for any youth. For our allies, help leveraging your privilege and being heard and being able to also step away or back as needed. Also, that what is said and how it is said for our young people, and I would add what is not said, is very important. Claiming who we are is vital, and encouraging our next generations to be and embody themselves, that we are strong, that they are strong, all children, especially our women as well, and that as we need shoulders, and we need to be honest when we need assistance and to take our breaks. Being honest about the healing journey that we're all on every single day. I don't know that it ever ends, but working through the various levels of trauma as they have come and as they continue to come, but being honest and true to our collective self to then be a viable patron out here in the world. We want to build our own table and inform our youth to be able to leverage their strengths and their leadership. Our youth have to feel valued. We need to break the cycles of trauma. We need to have being intentional about what healing looks like and addressing issues at their core, creating strategies and pathways for change, right? You've heard about just a few of resources and tools and strategies. I encourage you all to check into at least a few of them, and we're all here to help guide as well. Talking about persistence being another buzzword, right? Persistence being one preferred over resilience, and that we're cracking on the inside at times, and self-care is extremely important. Talking about the George Floyd examples and many other racial examples that have happened during the height of a worldwide pandemic and how extremely proficient that is. Having access, right, makes a big difference to where our youth can and cannot engage. Let's think about all levels of their access in an equitable way so that they can participate in well-meaning community service and programs. A lot more to say. So much gratitude to each and every one of you, our panelists, for taking time and a lot of prep time. Looking forward to engaging with all of you. Thank you to all of our participants, to Jackie Patterson and the Chesholm Legacy Project. Much value and appreciation to all of you. Continue to be good to yourself. Much more to come. Be well.